It's bad. You speak to anyone who works in the health service, they'll say, most people will say it's the worst they've seen in their careers. You look at the official statistics, paints a pretty similar story. The claims that this is the worst crisis in the NHS's history, that feels pretty plausible to me. I think the thing I'd add to that is, to some extent, we knew this was going to be the worst winter in the NHS's history. People were saying that in the summer, given how busy and how stretched the service was. We knew there was going to be a wave of winter respiratory viruses in the winter. And so what's slightly puzzling for people who work in the service was the lack of political discourse and leadership in that late summer and autumn period. We barely spoke about the NHS. There was that period of willful ignorance. And now, finally, the Prime Minister has come out and said the NHS is his priority earlier this week with that speech. But the slight problem with that is we're into the eye of the storm, or at least we're close to the eye of the storm. And when you're in that sort of period, the power of policy levers has been attenuated. There's actually just a lot less you can do about it now. So that's a slight problem.